Hello! And wow, this is the cast of mine, and today we are going to be doing... Well, we'll see in a moment. Here we go. Sponsored by... don't really care. Surgery Squad, anyway. Right, so...
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection.
Right.
Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
No.
No problem. Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
Okay, right. Just I want to say, I'm using Audacity camera, built-in camera with Windows 10 or Windows 8, and also Bandicam, and then Sony Vegas to finish it off. Using all those to record this and make this possible.
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
Okay, so I'm going to stick that right in there. Why aren't the sounds working? It's on full volume. No, it isn't.
Minutes to relax, and for their mouth to become completely numb. Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Oh, wait, I forgot something. Don't want to forget closing my door.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Putting on that tooth clamp.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Amazing.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Move out real close. Well, that means that I'm going to need to readjust the whole microphone setup. It's going to be all awkward. That's very awkward. You can't see half of me. Okay, stuff this looks laggy because it is laggy. I don't know why, it's just that weird thing.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection.
My feet hurt.
Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Put bleach in his tooth. What else are you going to put in?
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved. Great. Now use the suction to remove the bleach from the patient's tooth. Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
Is that from the gutter? Okay. Just stick that in there.
Looking good. A heated instrument is now used to remove the excess gutta percha.
As you can see right here, there's kind of a glow, isn't there? It's, here. A bit of a glow of my screen. Because it's a huge screen. If you've ever seen my tours of my room.
Pack the gutta percha into the tooth canal using a plugger. After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on surgerysquad.com.
Oh, okay.
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries here on surgerysquad.com.
How's New Year's Eve? I don't know what... Oh yeah, that's the nose. Yeah. Alright, so I'll see you in the next video, because I don't know how well this is going to work out, but I'm going to record the next one in a couple seconds, and so, you know, it's a bit funny. Luckily, I can see my webcam live. And it's like not even juttery, it's like... It's not like... It's like, woohoo! Free moving like 60 FPS or more. But... thank you for watching. The craft is mine. Signing out. Hope you've enjoyed this video. If you liked it, leave a like on the video. I don't have a catchphrase yet, like slap that like button in the face like a boss. No, I don't do that yet. But I'll come up with one soon. Maybe laying in bed I'll find out one. But thanks for watching. Hit that like button if you liked this video. If you want to share this video, just share it with your friends. More subscribers, well, don't care. Also, we're going up to 30 subscribers, but we'll talk about that in another video. But, thanks for watching. Because mine, playing Surgery Squad. Because mine, signing out. Goodbye.